So sometimes there's this extensions or other softwares are installed वो ना block कर देते हैं sir कभी कभार.
Okay,
Although
fine. Let's
using
start.
this,
Let's start. No
okay.
problem.
Hello and welcome to Heart Matters 2025, Experts Insight for Every Beat, our special World Heart Day series. This year's global call reminds us to take our heart health seriously and act early. Through these crisp, power packed sessions, we bring you leading voices from cardiology and preventive medicine to help you protect your heart and live a healthier life. And today, for this session, we are joined by Dr. Hasmukh Rawat, Director of Cardiology at Fortis Mulund, a renowned cardiologist with decades of experience in India and abroad. Dr. Rawat is an expert in interventional cardiology, performing advanced procedures like angioplasty, stenting pacemakers, and valve interventions, alongside a strong focus on prevention and patient care. His blend of precision innovation and compassion has made him a trusted leader in cardiac health. Welcome to our show, sir. It's great to have you with us.
Thank you, Simran. And it's privilege and part of the this program from the Voice of Health. And welcome. And let's start the things.
Thank you so much, sir. So, to begin with, that many of our listeners are still not familiar with the advanced procedures like angioplasty. If you could start by explaining us in simple words that what exactly is an angioplasty is and how it helps patients with blocked arteries.
Okay, fine. See, the angioplasty is done to remove the blockage of the heart. Now, let us know what is the blockage. Now, you imagine you have some obstruction in your house, in your water pipe. So, what will happen? You have the less blood supply in the house. So, you will try to bring the water from the neighbors and try to maintain yourself. Suppose the block or suppose the water supply suddenly cuts off because of some more blockage and suddenly cuts off. You have no water coming in your house and you will become the disturb. Exactly same thing. There's a blockage in the arteries of the heart. Heart has got two arteries, small tiny arteries, 3 to 5 millimeter, one on the left, one on the right, which supplies the heart. See, the blood flows from the heart. Blood flows from the heart. Heart pumps as the pump. Heart acts as a pump, but heart also needs the blood, which gives by these two tiny artery, which is called coronary artery, left and right. Left divides into two branches. So in total, there are three branches. If you get blockage of one of this artery, what will happen? Supply to that part of the becomes less. So when you walk around, when you get little stressed out, because of the less blood supply, you get chest pain, what is called angina. Now suppose because of some reason that blockage gets ruptured, you get clotting there, and that artery gets totally blocked. This is what is called as heart attack because of the blockage. That part of the heart starts dying, and that is what heart attack. Now, what angioplasty does? Angioplasty try to remove the blockage. In a simple word, what we do it initially we used to years back we used to do from the groin. Now we do it mostly from the hand. So from the hand or groin, you go to these arteries, what I called you as a coronary artery. From the coronary artery, once you reach there, you put small wire which is almost hair thin. On this wire, you pass the balloon. Once the balloon is passed, you inflate the balloon and the blockage is clear. Blood flow starts. Now, because of balloon, the blockage is little disrupted. It can again close down. It can close down later on what we call restenosis. To prevent all this aspect, we put little metal coil, metal spring, which is called a stent. Initially, stents were the only metals. Now the stent come with the medicine, which is called the medicated stents. So once you put medicated stents, the acute blockage, what we have done with the balloon, has doesn't come up, and long-term risk losses coming up the chance of the angioplasty, coming up the chance to blockage again with the stents comes down. So this is a simple procedure angioplasty. In a simple case, it takes around hour or so. Sometime in a complex procedure, it can take couple of hours. So it's a simple procedure compared to bypass, and the hospitals stay around anywhere from 2 to 4 days remains.
Thank you so much, sir, for explaining us the entire process in a very simple language and with a very amazing example, so that every person listening to this, all our audience can relate and understand what exactly is angioplasty and how it affects our heart's daily work. Sir, moving on to my next question. Since as chronic total occlusion and rotabulation is something which is related to cardiac health, but again, it is very difficult to understand for a layman person. And with this session, we aim for the maximum awareness we can create. So, can you tell us why these cases are more challenging and how new technologies are helping doctors manage them successfully?
Great, Simran. So the angioplasty is now for more than 3 decades. And what is patient needs? Patient needs good outcome. Your blockage has to be removed optimally. That is what patient understands. For us, it is a challenging thing. So when it comes to the blockage, it can be simple blockage, it can be complex. Complex in the sense sometimes during at the site of blockage, there's a major artery. Now, what happens when the blockage comes all of a sudden? As I mentioned earlier, it goes heart attack. So during the heart attack, there is a blockage, there is a clotting, angioplasty becomes easy. Now, when the blockage comes slowly and becomes 100%, there is natural bypasses comes and prevents the patient from the acute problems. So when this sort of a blockage, which has come slowly and become 100% or what is called a total occlusion, it because over of time at the site of blockage there is a hardening, what we call fibrosis. There is a lot of calcium, and it's very hard. Now, if you have the passage, if you have 99% blockage, chance of success of angioplasty is 99% plus, I will tell you in today's scenario with excellent hardware. But if you 100% blockage, what you mentioned is a total occlusion, the chance of success drops down depending on the expertise anywhere from 50 to 80%. 10-20% may not be still successful. Because what happens, because of the over a period of time, the blockage is there for a couple of months or couple of years, passing of the wire is difficult. You may have to take a hard wire. Complications of the angioplasty also become not unusual. So these blockages are hard blockage and crossing them is difficult. These are the case which requires expertise. Probably the average angioplasty man can do the 80-90% cases, but 10-20% cases are complex. You really need expertise to do such cases. So doing the total occlusion, it means the blockage which has been there for a years or months together, crossing them and doing the blockage, opening up and doing the optimal is a challenging thing. But with the newer hardware, newer thing, it is possible and more success comes with this sort of a total occlusion. Coming to your next question in rotablation. So you need to know rotablation is a part of device or one of the armamentarium device in a cardiologist uh, portfolio. It's not rotablation because the challenging thing is calcium. As I said, if you have the calcium at the site of block, it becomes challenging things because if you have calcium, the balloon will not expand well. Even balloon expands substantially not well, then probably the calcium will not allow the stent to expand. Stent doesn't expand and it becomes a little underdilated or underexpanded, which brings the acute closure, which can cause the further blockage. To prevent all the things, you need to do the calcium management. In the calcium management, you have a couple of things available. One is called cutting balloon. Simple balloon is like a plastic balloon, but on that balloon, when you put a metal flap and then do the ballooning, probably the calcium will cut. It is called cutting balloon. Then, as you mentioned, the rotablation is one of the device which can ablate or remove the calcium from the coronary arteries. It is a tiny device which spins or rotates at the speed of 1,60,000 to 1,90,000 revenues per minute, or the RPM. Okay, it rotates so fast. In rotating so fast, is a drilling, so it clears the calcium. And last but not least, the new device is called what is called IVL, intravascular lithotripsy. As you are aware that you have kidney stone, years together, you do sonography application and try to break the stone from the outside by what is called lithotripsy. Similarly, we cardiologists have taken this advantage or knowledge from this lithotripsy of kidney stone and try to break this calcium by putting the same ultravascular sound within the artery and break the calcium. So that is called intravascular lithotripsy. So these are do not require every patient. A patient, when you see a lot of calcium, this other device can be used depending on the anatomy of the lesion, length of the lesion, and the clinical profile of the patient. And the aim is only one, that you remove the blockage as much as possible, put stent adequately so that patient does not get acute problem and the long term stent doesn't get blocked, because any stent is reblocking at 2 to 9 or 10%. So if you do optimal treatment, optimal calcium removal, and the best of the things utilize, probably the coming back drops down. So this is how the your rotablation or any other device works in a angioplasty.
That is, I think, sir, which most of us would haven't known about this. But thank you so much for explaining this, sir. So, as we're discussing about the new techniques and innovations which are helping us to treat a heart patient or a heart attack. So, before that, there's this case when someone collapses in front of you with a sudden cardiac arrest. And we know that at that point of time, every second counts. So, why it is so important for even an ordinary person to learn CPR and basic life saving techniques, and how it can truly make a difference? If you could explain us or just comment on it, sir.
I think the CPR is nothing but the cardiopulmonary resuscitation. Awareness and training in our population is very minimalistic. Probably a lot of people don't know, even the healthcare personnel or even doctors also don't know the how to do CPR and awareness of this thing. This is very important thing. If you look abroad, probably they try to teach every citizen. Just to give example, as years back, somebody was in a gym and trying to do something and arrested because people around my got knowing the CPR and they have what is called a, ICD or defibrillator, patient is saved. So knowing the CPR is very, very important because you save one life. That is very important. So anybody get arrest around, probably you have to just out the things. Could it be hard? Could not be the heart. Most of the time, those who know how past history and suddenly happens, you have to presume it is because of the heart. So why arrest occurs basically? So heart, as you know, is a pump. It contracts every minute to the extent of 60 to 90 times. So if the contraction or pulse or heart fails to contract for a couple of minutes, okay, or what is called as a heart start racing because of the attack or because of something, heart start racing at a faster rate of 200 and 300, what we call as a ventricular tachycardia. So either of condition, whether the heart slows down or uh, uh, races faster, the heart contraction effect doesn't come. Heart contraction doesn't come means blood does not go in the body. So first thing starts with the brain. Patients start become drowsy to unconscious, and then it eventually affects the respiration. Patient stops or shallows breathing and stops breathing. So this is how the thing occurs. So what you have to do it sometime by doing some external manual, by some sort of mechanical stimulation, you can stimulate the heart for a normal rhythm. So what that is what a CPR. So you give the heart pressing, do one or two thumps. There's a protocol of CPR. You are one has to learn. So you thump around, so probably heart may stimulate. When it gets stimulate, you keep on pressing the heart at a faster rate so that artificially or from externally you are trying to push blood from the heart to the all vital organs. At the same time, a second standby, or if you not second standby, alternately pressing or in respiring the victim. You can do around the pressing or victim if you are alone or if you are somebody, take somebody help. One has to learn the thing. CPR training is a short training. So if you do this around, probably once in a lifetime or once in a time, you may save one life. That is very important. So every citizen, every health personnel, every people should know the short course of CPR, go to the YouTube, maybe some learning, this thing. Lot of hospital, lot of people conduct the CPR short training. It's not for others. It might be happen that it may happen to your family once in a time. So if you know around, you can save your family member. And if you are around, probably you can save somebody's life. So very important to learn the CPR.
Very rightly mentioned, sir. It is something which can save a life. Either it could be your family member or someone ex family member, because every beat, every life matters a lot for
Yes.
us. Thank you so much for explaining us that, sir. As we are moving close to our session, but we won't let you go before we get that final remark as we mark the World Heart Day 2025. What would be your key message to people about early detection, preventive care, and the role of advancement in intervention in saving lives?
Uh, Advances are tremendous. We haven't mentioned the other heart problems. As you know, heart is a structure with a coronary problem, which all of us are concerned. Apart from there is something called heart valves are there. Then something called the pulse problem heart, which is the rhythm problems, is a separate specialty. Now, of course, the child gets some heart problem like a holes or something is called congenital heart disease. So there's variety of heart diseases are there and a variety of consultants available. It's all different, especially in today's scenario. As far as the valves are concerned, we have not mentioned about the things, but valves are concerned. Heart has got four valves. Every valve can get disease in the form of narrowing, what we call as stenosis, or leaking, what we call regurgitation. So that's what happens. The more prominent valves are the aortic and mitral on the left side. There are other two valves also there. Every valve is important, but left side are more important. Today's advancement occurs. Nobody wants open heart. Nobody wants a scar on the chest from the chin to the tummy. Nobody wants it. Everybody wants a minimal invasive or a non-open heart procedure. So to support all the things, a lot of advancements are done. What is to happen? Elderly people who cannot get operated, you, you leave them alone. But nowadays, like say aortic valve, if you have the aortic valve disease or aortic valve stenosis today, you can treat all this patient with the morbidity or with any of the high risk without open heart surgery, which is called TAVR or trans aortic valve replacement through the groin. Patient remains hospital for 2 3 days and the valve replacement is done. The leakage of the left side called mitral leakage, it happens in so many patients with the end-stage heart disease. New thing has come, what is called mitra clip. And by this mitra clip, the same procedure without opening heart or replacing the valve, you go from the groin and prevent the leakage by putting some clips. So these are various advancements as far as the valvular structure is concerned. Coming to the next, what we should do it. Simran, you and I have discussed a lot of cardiology, advancement, device. But if you ask me why all this,
Yes.
why all this?
So this is
Provided
basically,
you,
yeah.
provided you do prevention, you are
Yes.
vigilant for yourself, prevention. Why to get heart problems? So that is important that society en mass or individual by himself take care of the himself or a society and try to prevent heart problems in the form of he becomes vigilant for himself. Vigilant in the sense that he has some symptoms. Don't leave it that I had last night some food and I got acidity. I have seen a lot of people dying because of diagnosing himself acidity, and next day they'll end up in ICU and realize that last night it was not acidity but a major heart attack. So if you have some sort of a symptoms, respect the symptoms, vigilant for that, and try to get help from the nearest doctor or hospital. You become proactive for yourself, regular checkup, weight maintenance, whenever required the heart checkup. You become proactive for yourself. Timely intervention is necessary in the sense that if you have a problem, take some expert opinion. Don't compare yourself with the other buddy. Okay, this guy has a two blockage and he lived for 20 years and I had a one blockage only. I should go with medicine. Everything is different. So you assess yourself, take expert help, and do timely intervention. Probably you will save yourself. And last but not say, list, as I mentioned, healthy heart, stress. In today's scenario, stress starts from the childhood. Moment you put the children into the school, you know how the schools are today compared to the 2 decades or 3 decades back when we studied. Competition comes in the matriculation and getting the this thing. Then comes a job. Then comes a business. We are living that we are living in a very stressful condition. So one has to adapt to the stress, have the passion for the work rather than the looking for the remuneration from the work. If you have passion and you have dedication, you like the things will follow it. What I believe, and you take the voice of your heart, what your heart needs. Don't overexert yourself. Don't overdoing the things. Keep healthy weight, diet. We have the very bad dietary habits. Nowadays a lot of diet with the. If you look at the pizza, pasta, burger, the way the young people doing the job for 12 hours and engulfing all this high calorie diet with the high cholesterol, that has to be redefined. So my takeoff is that rather than taking treatment, put more effort on your prevention. Important diet, exercise, and stress are very important, which you can take care of yourself and you can prevent yourself from the heart attack and heart illness. Thank you.
Thank you so much, sir, for this amazing session and for the amazing expertise you have shared with us. It really helps us to educate and aware our public. And like you said, why are we talking this? This is for the prevention. This is so that no one lands up in that situation where they have to go to hospital, have that scar or multiple surgeries. I think no one wants that. So thank you so much for creating this awareness with us, sir. It matters a lot on this, especially on this World Heart Day 2025. Thank you, sir.
Thank you, Simran. I think the message is very clear and I think it should help the people. Thanks very much.
Yeah, right, sir.
Thank you.
Thank you, sir.